wide awake now after a wonderful international night and ready to enjoy a very interesting and engaging presentation. Professor Neville Calleja is the head of the Department for Public Health at the University of Malta Medical School, which is affiliated with the Association of Schools of Public Health in the European region, ASFER. He is also the Director for Health Information and Research within the Ministry of Health in Malta, Europe. He also served as Chief Medical Officer for Malta a few years ago. During the COVID-19 emergency period, he has been a senior member of Malta's COVID-19 response team and has also been involved in discussions on COVID-19 monitoring and other public health policy at the European Union level. In addition, since 2020, Professor Calleja has been supporting WHO in Geneva in various global consultations to shape WHO's Infodemic management research agenda and competency framework, and contributed to several training schools in infodemic management covering over 1,000 infodemic managers globally. He's also been supporting WHO in Europe with assessment of national health information systems since 2016. Please join me in welcoming Professor Neville Calleja.
Morning, everyone. I hate to be in this position. After the party last night, I feel like really a massive party pooper. Anyway, so I'll just get my timer on. Yeah, okay. Okay, so welcome everybody. Congrats for making it this morning, despite all the odds. I think I had to acknowledge the fantastic work of the vaccination campaign here in Brazil on my very first slide. And that's our lovely cartoon character you see on the first slide. So yeah, Malta. I guess probably some of you might not actually know where that is, and I don't blame you. I think it's a piece of information you can live without. But it's basically a very tiny island in of the Mediterranean, 35 kilometers long, and we're 500,000 people. So it's a bit crowded in some places, but still nice to visit if you're in the area. Okay, so yeah, the introductions I think have been made. So indeed, coming from a small country, you typically have to wear a lot of hats. So those are some of my hats, current and past. I think these are the main ones obviously relevant to our discussion. So how did the story start? And I hope this sounds familiar to quite a few of you. I'm sharing some of our experiences in our tiny country, but I hope they resonate with your experiences. It was lovely listening to presentations yesterday. Our Guatemalan colleague was mentioning some very familiar misinformation as well. So it's amazing how international this thing got. So yeah, this is probably how you heard about it, like we did. And this is how our population started to hear about it. Bergamo is in Italy, not too far from us, you know, scarily close. And we were getting these pictures on our national television, you know, all day. Now, what happened was a very interesting story. We immediately saw a new page coming up on Facebook. Now, Facebook is probably the most widely used social medium in Malta. And we said, fantastic, nice. And we sort of tried to start engaging with this to ensure, you know, we help out. Eventually, this page started turning nasty. And it started really scaring people, okay, sharing some very weird snippets of information. And then we realized it was actually set up by an enterprising young man who then started selling face masks at 50 euros a box and sanitizer at exorbitant prices. I mean, you might as well buy caviar instead of sanitizer at that time of the year. So anyway, he was caught out, and actually ridiculed by several satire pages on Facebook, as fate might have it. So it did fizzle out eventually, but this made us realize that there is something out there. We didn't have a name for it at this point, but people were being faced with a flood of information. Good or bad, but they were being faced with a flood of information. And they had huge thirst for information. Okay, this was a huge unknown. So actually this led to a proper page being set up actually by the Association of Public Health in Malta, which soon reached a reasonable number of members. I mean, 21,000 in a country of 500,000 is not too bad. And that was achieved, I think, within a few months. So, yeah, I guess this is a familiar story for most of you, okay? So, most of us, most of the people we work with, they have the second reality they live in, which sometimes they actually mistake for their first reality. And basically what they see in social media pervades their everyday life, okay? So before, now this obviously has created a phenomenon, a very important phenomenon. Before, when we didn't have this kind of amplification, anyone saying a stupid thing would probably be ridiculed. I'm not saying it's a good thing, but let's say it would die there and then, right? Now, that person, he or she, is going to find other people, other like-minded people in pretty much a very short time. And it can gain critical mass. And that's an important phenomenon we have to acknowledge when trying to communicate now in public health. Okay, so I feel the power of the meme is something we need to harness in public health. And definitely I will share some of the good ones with you during this presentation. Otherwise, I'll bore you to sleep anyway, so. Okay, so yeah, and it's amazing how people feel super sensitive about sharing information for the interests of public health and making use of that information for their own blessed health. And yet, they don't even bat an eyelid to share what they ate this morning, what time they went to the bathroom with Google and iPhone and everybody else. Okay, so yeah, I think you've realized probably, same as I did, that even in information terms, any vacuum will fill up very quickly with whatever is available to fill that space up, whatever the quality, okay? Science back then was trying to scurry to find explanations, myself as well. And in fact, that's really how I got involved with WHO. I was badgering them. Most of them are my old friends, both Geneva and WHO. We also have ECDC in Sweden and Europe, which sort of coordinates this kind of response. Nothing. We were getting no information. Anyway, eventually I managed to get a direct line into Wuhan Hospital, and that actually helped us a lot in our emergency preparedness. It was a 90-minute phone call, which was priceless, at least to set us going, because then obviously things changed. But yeah, we were basically realizing we need to do infodemic management before the actual thing was invented. Yeah, I think you might recognize some of these, okay? This is what we were being faced with in 2020. Some of it is still around, and again, that's a very interesting feature of social media, how old stuff gets recycled and appears again sometimes, looking new. Case in point, the measles, the MMR vaccine issue, right? The same articles get recycled over and over again. Luckily, through also attempts, also by WHO, I must admit, some news outlets have developed mitigating strategies for that. For example, putting a date, telling you this article is more than 2 years old when you open the article. So, things have moved on since then. Something else which we might have to acknowledge, despite, this hurting us a bit, Another thing that did not help us in the infodemic is changing evidence. Well, it was developing evidence, really. I mean, this was uncharted territory, so you can't blame anyone for having to change direction eventually as new evidence was coming in. But obviously, whoever wanted to capitalize on that change in direction to sow uncertainty in public opinion obviously made very good use of that change. So I'm sure all this must have sounded very frustrating to those of you trying to do something during the pandemic. And I'm sure you sort of looked at the mirror and said, like, why did this have to happen to me in my lifetime? Well, it has happened before. But unfortunately, we don't really learn our lessons that well. If you look at the flu pandemic in 1918, and you look at coverage and media at the time, you can see that many of the challenges they were facing, we faced. Possibly it was a bit worse for us in terms of the speed with which information was flowing. Okay? So, yeah, we had anti-vaxxers and anti-maskers back then as well, 100 years ago. And the word misinformation was not invented now. Okay, so as you can see, these are a couple of cartoons that did come out in British media when smallpox vaccinations started being introduced. So, yeah, we are reinventing the wheel, I'm afraid. And this is a lesson to us, to all of us, especially those in health authorities, that we need to learn lessons. I'm seeing many governments just ditch everything that was developed in COVID to go very happily back to 2019. No lessons learned, okay? And as public health practitioners, current, and I guess some of you are budding public health practitioners, we need to make sure that this happens, okay? Yeah, the political layer, okay? How much have we been blamed as a public health profession of making, of taking certain action or making certain recommendations, but in reality it was how the political layer implemented our recommendations. I'm not saying politicians are stupid. I'm not saying politicians are corrupt. Some are, but not all. Okay? Most of them tend to know what they're doing. You also have to keep in mind that we are public health experts. Politicians have to deal with everybody out there. I must admit, through this experience, I have worked very closely also with my Prime Minister. We've had our times. I've had a couple of opportunities of shouting in his face as well. We respect each other a lot in the end for what we have achieved over time. But I have learned that business needs to be taken care of. Tourism needs to be taken care of. I've had friends come up to me telling me, half jokingly, because they're very good friends, but they're working in the tourism industry, you've almost killed us of hunger those 2 years. Okay, so everything has a price. Nonetheless, yeah, this has not made our life easy. Okay? Infodemic at political level. Yes, unfortunately, all of us are subject to misinformation and being sucked up into the whirlpool of misinformation, including our political leaders, including our religious leaders, and I don't need to elaborate on that. I'm sure you've had your own experiences. Okay? These are real parliamentary questions I got from an ex-Minister of Health in my country. And I hope they're not too tiny, but I think if you manage to read a couple, you might sense what has provoked this question. You might have seen that before. Okay? So yes, everybody is actually subject to misinformation, not just your healthcare workers, but your religious leaders and your political leaders as well, as we have all learned. Okay, so yeah, I think we sort of talked about this. Technology has definitely changed the way information is produced, distributed, and consumed. Okay, and We have to be careful, by the way. When we think of this whole infodemic, misinformation, disinformation, please do not think only online. There's a lot that happens offline. There's a lot that jumps from one platform to another online, and from online to offline, via radio, via word of mouth, via newspapers, especially in many of our countries where maybe the penetrance of the internet is not as widespread as we tend to assume in the West. Okay, so we have this now new phenomenon of also personalized information. Okay, so the information we consume is personalized through basically artificial intelligence algorithm. AI has become a sexy word now. I mean, everybody says AI, AI, AI all the time. But in reality, what is AI? It's an automated process that learns from the data it captures to personalize, to shape the output. And that's exactly what our social media has been doing for probably the past 10 years, quite successfully. Okay, so we need to keep in mind these, let's call them 3 truths. Okay, first of all, we're facing an information ecosystem that's multidimensional, as I've just described, online, offline, and multiple dimensions, and interconnected. Okay, and we need to take cognizance of that. I think, again, I have a bit of a comparison here with just, 25 years ago, right? Even though we did have the internet back then, I remember my first online purchase in 1998. I bought some ties for my medical school exam. It definitely has changed. And I think those 5 points you see there on the side, I hope are points that you can agree to, okay? So we're seeing a challenge in terms of closed messaging gaps, like WhatsApp, for example, where you can't really know what people are talking about. We also have imposter content, and guess what? Our good friend Elon Musk and Twitter decided to ruin the blue mark, which was, I think, a very good thing. And I think from what I've seen lately, Facebook is also cashing in on the blue mark in a paid manner, same as Twitter has been doing. We've seen this intersection of hate speech and rightist ideology with misinformation. And that has been very explosive. The power of the meme, okay, on both sides. Memes can be very effective in delivering messages. Any message, good or bad, misinformation, disinformation, or correct information, okay? And here, actually, I'd like to give a little plug to some fellow infodemic managers in Indonesia. I think Indonesia competes very well with Brazil in terms of meme generation. And if you really want to look out for good memes, I would definitely recommend these 2 countries to look for good memes. Mafindo is one organization in Indonesia that has been actually making powerful use of memes throughout the pandemic, very successfully, I must add. And yeah, basically we're seeing conspiracy theories coming into the mainstream, as I explained earlier. The personalization of this information ecosystem, I think we discussed already to some extent. Okay, so without knowing, everything you do in the presence of your mobile is being tracked. Simple as that. I don't know if really sound bites are also captured by mobiles. I honestly don't know. The companies say it's impossible in terms of bandwidth requirements, etc. I must admit I do get my doubts sometimes, but anyway, anything you do is being tracked. And that is being used to shape your experience, okay? And again, please do not be fooled when reading through your Facebook wall that reflects public opinion. that reflects the opinion of the vociferous few, okay? It might not reflect the opinion of those who are just reading the comments, but not engaging, or even those who do not engage, full stop, and don't even read the comments. So this is very important. Let us not base our public health campaigns and policies necessarily on what we're reading through social media, because that is also skewed. It's not representative of public opinion. So we always have to keep that and that bias in mind, okay? And yeah, it's basically creating a new addiction, okay? It's an interplay with your emotions, with people's emotions, okay? And it gives, basically, we're talking now in studies of a dopamine reward loop. The quest for likes that we also see a lot in our youngsters. And I think probably many of you must admit that when you post something, you do check sometimes, let me see how many people have liked my post, how many people have liked my cat or something, whatever. Okay? So, yeah, we have to always keep in mind the digital divide, and this applies not only to infodemic management, but also in the use of AI to shape health policy. AI feeds on what is available out there on the internet. If I ask ChatGPT to write me, I don't know, a 1,000-word essay on what infodemic management is in English, it typically performs pretty well. If I try to do that in Maltese, which is my language, and I guess you realize there might not be that much content on the internet in Maltese, I can assure you, if you speak Maltese, you would have a couple of good laughs. Okay? And this is reflective of the fact that not everyone out there is represented in the data landscape. We have to be very careful when applying AI tools in our policies, including, obviously, risk communication and community engagement. Okay, quickly, some definitions. I'll just leave them up there for you to see. But I think it would be a good time now to talk a little bit as to what exactly is the difference between infodemic management and RCCE. Aren't they the same? Well, they certainly do overlap a lot. But I think if I can draw an analogy, RCCE is an excellent science to develop the content and to actually communicate this content to the population. But what we're facing now is that this message has to squeeze its way through a tsunami of dirty water, if I can call it so. Okay? So what infodemic management is doing is trying to help understand that dirty water, that tsunami, and clear a path to help message penetration. And frankly, it's not just useful for RCCE, but I hope to see infodemic management mainstreamed in many other disciplines. It shouldn't be even limited to health, frankly, because we get faced with misinformation about anything, all right? Be it conflicts here and conflicts there and whatever we do in everyday life. So if we had to look a bit like how information elements evolve through the infodemic, what typically, kind of triggers them are questions, information vacuums, and concerns, okay? That then will generate misinformation, particularly in the absence of quickly available good information. Also, frankly, misinformation appeals to your emotions much better than, playing good old boring public health communication, right? So we're at a disadvantage there. Misinformation is distinct from disinformation, and I would really like to make this very clear. We're seeing a lot even of international organizations working on curtailing and bringing people spreading disinformation to justice and lumping misinformation with under the word, or rather lumping disinformation under the word misinformation. In reality, these are two very distinct phenomena. Disinformation is malicious information being generated and spread with malicious intent. It's typically deliberately false. Misinformation is typically misinterpreted correct information, which is being shared by concerned individuals. Some of the best misinformation nests that there are out there are Facebook groups designed for new moms. Can you imagine somebody more concerned than a new mother? And it's only natural that they will seek information. And that's how a lot of misinformation spreads. They are concerned individuals. Do you honestly think your, I don't know, religious leaders whom you've been grappling with during the pandemic have malicious intent? They don't want to do the right thing for their congregation, for example? That's misinformation. And I would say 80 to 90% of the incorrect information we face out there tends to be misinformation and not disinformation. And basically, as public health, where we can act best is here at the information void level. And this is why the trends that many international organizations are taking in addressing these two is very worrying, because it's actually not efficient, not cost effective. It's very difficult to catch it when it's spreading already. It's much easier to be on the alert and try to make sure to get it young, so to say, okay, when the information void is there. And this is again what infodemic management is about. It's so much more cost effective to deliver the right information when the question comes up than trying to debunk misinformation repeatedly on different channels, okay? It's very important, and I think those of you who are RCCE trained know this very, very well. In my language, we say, God gave you 2 ears and 1 mouth for a purpose, because you need to do much more listening than speaking, okay? And I think you know this. I don't need to harp this any further, okay? How does misinformation flow? Do we know anything about its dynamics? This has been studied quite a bit during COVID, and there is such a thing as misinformation waves. They tend to predate epidemic waves. If you had to map them on top of each other, when an epidemic wave is coming, so typically it's already happening somewhere else, right? And people are getting to know of that through social media, etc. Misinformation starts rising. And then when it actually hits, people tend to, not everyone, but many people tend to try to go to a good source of information. You know, once you get COVID, you try probably to get advice from a person you trust with your health, as opposed to your hairdresser, okay? If we had to look at the same model, okay, we spoke a lot about flattening the curve during COVID. I think we can look at these 4 stages in infodemic management. First and foremost, the listening, the preparation and monitoring of what's happening, what's being spoken about, okay? And we need to detect and understand what's being spoken out there. Again, don't focus only on the online. By the way, WHO has a very interesting tool that you can all use in terms of what's being said on social media. Don't worry, it is ethical despite what is being said out there, because it's anonymized. And if you want to have a look at it, the website is who-ears.com, okay? For example, I think, again, I know very little about what's being spoken about in Brazil, but it seems around about September 18, there was a spike in talk around vaccination of healthcare workers and transmission of COVID in local social media. And I got this from this website. You might agree or disagree with me, but I'm just sharing this with you from what I got from this website. Okay, then we obviously need to intervene, but not just intervene. We need to think sustainability. We need to build structures. We need to strengthen our response capacity. None of us have unlimited resources, okay? So we have to learn lessons as we go along and build structures, okay? This is very much the same thing, but maybe looking a bit more attractive. But basically it's the same thing. Listening, developing implementations, and strengthening systems and policies. This is what has happened in WHO, and I must admit I feel very lucky to have been involved. I think it was a twist of fate, you know, more necessarily than credit to myself. But it started off very early on in the pandemic. The first publication, I think, came out around about June, following an online consultation, a massive online consultation at high level that started in April. And most of us were hit by the pandemic around about March. So I think it was quite proactive. And then further work happened. Basically, WHO is trying to also guide research into this field with the second publication. The third icon you see there is the tool I have just described, the WHO ears, and the training. And again, credit to WHO and all the organizations involved. I know CDC was heavily involved as well, UNICEF, etc. 1,400, I believe, infodemic managers have been trained worldwide by an excellent crop of people I feel super lucky to have worked with, some of whom hail from this beautiful country. I'll refer to them later, actually, because I think they need to be given credit. So the last publication is on competency framework, and this is, I think, particularly helpful for those of you looking towards building capacity for this in their respective country. It doesn't have to be expensive. It doesn't have to be technologically sexy. Actually, some of it can be done manually using existing tools, okay? So I would strongly recommend having a look at these publications, because I think you'll find them very useful in building capacity in your own countries. Each of those, each of these areas, you'll find them split in terms of objective, tasks, knowledge, and skills. So it will also help you not just recruit new staff, but maybe retrain or give continuous professional development to your staff to give them these skills. But does the infodemic really hurt? Well, yes, it does. I'm not sure if you've had experiences yourself, but I think I'd like to highlight some things that you probably have observed, okay? So we've got obviously misplaced actions, okay? Guided by that information that they have received, good or bad. We've had victimization and stigma, all right? It was very sad to see public health workers. Back home, I like to tell my students that public health went from 0 to hero to Nero. You know Nero, right? The Roman emperor who burned Rome. Okay, and in reality, many of us have experienced this. We were something that people just didn't really think about, okay? Part of everyday life. You know, like your internet provider, it's there, you know, or your water in the tap. And then we were clapped and, you know, and in balconies and stuff. And then some of us had to close themselves inside because there were mobs outside their door, okay? Maybe you're familiar with the word doxing, okay? So we've had a lot of doxing happening also for public health workers. Again, falling for scams, I mentioned the face mask, the sanitizer prices at the initial part of the pandemic. By the way, did you guys get a lot of toilet paper hoarding during the pandemic, right? What was that about? Yeah, trust. It definitely has eroded trust, and this is another important for infodemic management. The trust during a pandemic is a function of the trust before the pandemic. The countries who did well in terms of the interaction between health authorities and the public were those who had banked a lot of trust before the pandemic. Those who didn't have a lot of trust to bank on basically ended up losing the little they had. So this is important. Infodemic management is not something you do when the outbreak hits, but it's something you do continuously, possibly accelerating things when the outbreak hits. Okay? But we need to build that trust bank. Okay? Needless to say, the mental health prize, probably all of you have seen it. I'm in health statistics by trade, and I can say that our female suicides are usually a flat line, thankfully. But in 2020, 2021, we saw a solid rise in female suicides, which then thankfully dropped back in 2022. Okay? And here I must acknowledge, in many of our societies, love it or hate it, women have made much more sacrifice than men have done, because also of the measures that we had to implement. Okay? So this, in a way, is rewording a bit what we've seen before. The direct impact on health. Many of our countries that basically have stopped elective healthcare during the pandemic are suffering now with very ugly secondary complications of their non-communicable disease patients. We have countries in Europe where a new case of metastatic breast cancer would have to wait 12 weeks to see an oncologist. Now, in some countries, this might be understandable because of under-resourcing, but these are countries where typically that lady would see an oncologist most of the time on the same day, if not maybe on the following day. Okay? So it has had a price. Also, it has generated stigma and confidence in interventions that we have been doing for a long time. We've seen neonatal vaccination drop in several countries, and not because of the restrictions, because it has remained low in a number of countries. And it has definitely eroded social cohesion, us and them, okay? The maskers versus the non-maskers kind of thing. Okay, and these are some just few headlines I have picked up from the media just to show you that yes, misinformation has a very palpable burden, okay? These are coming from different parts of the world, UK, India, Africa, with US influence, I must add. So again, the phenomenon of social media, nothing is national anymore, okay? I don't want to point fingers, but you might see that one platform appeared twice in these headlines, and I think it is the platform now that we're seeing a lot of misinformation spread, especially amongst our youngsters. And the last one, by the way, is ChatGPT precursor, Eliza, which has apparently advised this young Belgian man to actually commit suicide, based, of course, on what it consumed through the internet. So what are the challenges bearing down on an infodemic manager today? Is there a role for infodemic management today? Oh, yes. We're coming up for, at least those in the Northern Hemisphere. In the Southern Hemisphere, it might be different, but in the Northern Hemisphere, we're coming up to a new winter, a new vaccination campaign, and many of the mistrust that has been sown the past 2 years on social media is there. Many organizations who were actively pushing that mistrust are realizing the potential. Really? Oh, okay. We're also seeing a lot of court cases. Okay. Yeah. We're also seeing a lot of court cases coming up for public health to face, basically, including on our communication practices. And I've had direct experience of this as well. And unfortunately, whilst there is a lot of help for the COVID skeptic side, where the international organizations, the German one, Querkender, I think it's called, QAnon in the US, even though it seems QAnon has moved on to greener pastures lately, but you know, these organizations are actually in very good communication and they exchange experts where required. We're not seeing this for public health. And I say this unashamedly. So we did try to get assistance from the international organizations in finding experts willing to act as court experts, and it has been, you know, dead silence, basically. Talking science in a court of law, I'm not sure how many of you have done that, especially for the trainees amongst you. It's definitely something I would recommend experiencing. It's quite a challenge because judges don't speak science, okay? They speak a different language, they have a different logic, okay? So you need to actually explain scientific methodology in a court of law before actually starting exposing your case. Misinformation has spread to other grounds now in health. Okay, so yes, there is a role for infodemic management. In Europe, the NCD unit of the Copenhagen office, of the Euro office, has actually published a misinformation strategy to address the misinformation that spreads around NCD control and prevention. And I think you'd probably agree there's quite a lot of that, and it definitely needs to be addressed. So I'm just sharing some examples here, how we still see a lot of this hovering around, especially on social media. Note the patterns. Racism is very emotional, okay? Lack of knowledge, you exploit the lack of knowledge. Typically fake pictures, frankly, this has nothing to do with whatever they're trying to talk about there. It's actually amoebiasis, not leishmaniasis. Okay, you probably can teach me on this. And the language, terrifying, okay? Rocks the nation. Sowing doubt, refugees in inverted commas, okay? And you'll see that I got a lot of examples from TikTok, I'm afraid, okay? So we get to see a lot of this. My wife's an obstetrician, she deals with this, you know, all day long. Yeah. I'm not sure if any one of you saw this. I would definitely not recommend eating that. And yeah, basically, our youngsters are, you know, being impressed by this kind of stuff, okay? Very fit young lady. Clearly what she's doing is working, right? Yeah, the research on the matter has been happening for some time, and I think we have to talk about kids here. The potential of developing information literacy in kids and in our upcoming workforce. It's critical, okay? And I think it's the most sustainable initiative we can actually work on, okay? I think all of you can read. This was done in 2016, but I think a lot of this is still prevalent. If anything, we actually can't rely on the blue mark now. Do you know about the Jesus Twitter account that got a blue mark? Huh? Did you read about that? Okay, so yeah, anyone can get a blue mark. Okay. So basically, what am I saying here? We need to adapt. The time of, you know, wide public health campaigns, hitting anyone who might be listening, may be slowly over, okay? People are accustomed to personalized information. We need to hook into that, okay? We need to basically challenge our assumptions of where people are, how they're interacting, what information are they seeking, and who are the communities that are our stakeholders. And we need to work with the stakeholders, not just shoot leaflets from a plane kind of thing, okay? So again, how do people perceive healthy behavior? How do they interact with the health system? We need to basically become more human-centered as opposed to population-centered, okay? And we need to go definitely beyond just what AI tells us, okay? We haven't gone through an educational system in public health for nothing. We need to trust the pulse of the communities we work with and not just rely on whatever AI is generating. Why? Because AI is giving you feedback on what it finds online, okay? We need to make sure they're used in new mediums, okay? This is like with teaching, right? I mean, all of our universities have these fantastic virtual learning environments. And I have to push my students to actually log in the virtual learning environment because they're not there. You might say I'm primitive, but frankly, I find it easier to have a WhatsApp group with them because I know that what I send there, they'll see it. I might even push a link to the VLE through WhatsApp. Fine. Okay, but we need to be where the people are. And we need to use the language they're using. Is it memes that get to them? Let's generate memes. Okay? This was one meme that was circulating online during the vaccination campaign in Malta. That's a very popular brand of sausages back home. And it wasn't actually generated by the company themselves. You see the comment up there, by the company, that they were surprised themselves, actually. This is a quote I heard from a good friend from an Indian advocacy group. And I liked it immediately, and I captured it for my slides. He basically compared the digitalization and the social media, the digital landscape we're living in, not just to a fad. It's not a fad. It won't go away. It will evolve into new platforms, but it won't go away. So basically, we have to deal with this on the same scale as, say, British public health dealt with the Industrial Revolution. It's a definite paradigm shift. Okay? And I've already mentioned this. We need to invest in children, not just in our public health trainees, not just in our medical students, our nursing students, healthcare students, okay? But we need to start from early on for their own sake, okay? To help them achieve information literacy skills, then can help them sift, okay? The wheat from the chaff, we say in English, right? The good stuff from the bad stuff. Just a few words of advice and I'll start closing, actually. Yeah, communicating about COVID now is very difficult. It's definitely passé, and the world wants to forget about COVID, including those lessons that could be learned, as I said earlier. What you invest in, always try to think of sustainability. Trust me, if you go up to your minister and cry for money, 95% of the time you will get a no, okay? So you need to make do with what you have. Upskill, upgrade, and build structures. Stand on the shoulders of giants. Trust me, I come from a small country. We don't have the capital to learn stuff ourselves most of the time, but we build on lessons that we gain from other countries. Okay? So use your networks. Those infodemic managers that I mentioned, those 1,400, are still in contact on WhatsApp groups. Nothing fancy, but it's great. You know, I've seen this in our local media. Has any one of you encountered this? Yes, a guy from Croatia pipes up. Yes, it came out in Hungary last month. This was our response. Fantastic. Can you send it to me? I'll Google Translate it and work on it. It works. Yeah, as with all public health, keep your eyes peeled for the wave of opportunity. Okay? The policymaker won't come to you when you want him or her to come to you. They will come to you when they need you. So you need to learn to spot a wave and ride it. And I cannot emphasize this more, if you do engage in, so to say, hand-to-hand combat in infodemic management, respect is key. I'm not sure if your mother or your father has ever convinced you to do anything simply by screaming in your face. I think your initial reaction would be, stuff you, okay? So nobody has ever been convinced by being called stupid or an idiot, okay? Respect is key. Even when the person addressing you is not showing you respect, do not fall at the same level because it will be turned against you. Excuse my French, to bite you in the butt, basically. Okay? You know, last time you told me that. You remember you told me that? You get these comments, actually. One very last important point. Infodemic management can be dangerous. RCC can be dangerous sometimes, especially in certain environments, okay? Be wise and preserve yourselves. I must admit I've had situations where I had to share information which was not in line with the political understanding at the time during the pandemic. And I tried to do that very, very carefully. Sometimes just sharing a resource online, that's it. Not even a commentary, just sharing a resource, leaving it out there, okay? So be careful, okay? Play with the brain and not with brawn, okay? Because dead heroes are useless heroes. Some of us can do it, but most of us, you know, let's be practical. Most of us, we should, even those who can be heroes, trust me, they do it in a very calculated way, okay? And I cannot finish without acknowledging these fantastic 3 Brazilian ladies I have worked with. The internet tells us that Brazilian ladies are amazing, but not only because they look good, they are good. And here I need to acknowledge 3 colleagues, Isabella Balalai, Lucia Campos, and finally Natalia Pasternak, who has actually been helping us also on the ground in Malta, even though she's far away in the US and Brazil. Thank you very much, and I guess it's time for preguntas, right? I'll put these on because I understand not everyone's English speaking.
Great. Thank you so much, Professor Calleja. We do have a few minutes for questions and answers, so do we have any questions from the audience?
Buenos días, muchas gracias por su excelente presentación. Sí quisiera preguntar si usted considera, y seguramente por todo lo que he expuesto, incorporar, por ejemplo, formación en bioética frente a los retos que hay con la era digital, porque estamos hablando de avances en telemedicina, en la credibilidad incluso de los sistemas de salud frente a la infodemia o al manejo de la infodemia que tenemos. Entonces, creo que en los planes de capacitación muchas veces no se incluye la bioética. Entonces me gustaría escuchar su percepción sobre ese tema.
Okay, yeah, great question. In fact, I sort of touched upon it briefly when I mentioned social listening, okay? In fact, this needs to be, yes, I think we need to equip also our future infodemic managers with this kind of information. Any data capture needs to be ethical, just like any other thing, just like any other research. if you look into the documentation, for example, around that website that I shared with you, there is an explanation that it is anonymized data captured from publicly available fora on social media, and data dumps from social media, anonymized. Okay, so obviously the country they're coming from would be available, but not Neville, Calleja, okay? So yeah, in capturing information, data privacy concern applies like with every other research. So, and I know there's a lot of, again, possibly misinformation around this, around how we carry out social listening, okay? I have not yet seen social listening being used in public health using personal data, okay? That's not to be said of some attempts at rigging elections with social media data, and I think you've been following the news in the past, okay? But in public health, anonymized data has always been used. This needs to be emphasized, and it also needs to be emphasized to our trainees who might be engaging, or ourselves who might be engaging in research on this matter. We can listen without breaking privacy rules. Yes, it can be done, okay? And frankly, many people still put whatever they want to say out there for public viewing anyway, but still, we add that layer of anonymizing data before using it for social listening. I'm not sure if that answered your question, but it is an important element, I agree.
Lo voy a decir en español también. Muchas gracias, muy importante tema. Tiene nada más dos preguntas. Una es si usted cree que en el contexto específico de emergencias debería de ser el oficial de salud el que esté enfrente de la cámara y no necesariamente el político, especialmente cuando se habla de confianza, trust, lo siento. Y la otra cosa que iba a preguntar, mencionó un poquito de utilizar el internet para poner información afuera cuando el medio político no favorece, la expresión de la ciencia real. ¿Cuáles son otras estrategias, especialmente cuando tenemos países donde, reporteros son asesinados, donde gobernadores están diciendo que agencias de salud están diciendo mentiras, etcétera, etcétera? ¿Qué más podemos hacer para preparar también si tenemos un gobierno más amigable un año y otro no tanto el otro año? Gracias.
Great question, and I think this comes back to the preservation. I think we're trying to improve public health, the public's health, but not necessarily at the cost of one's life, or, so we try to do what we can do. I did what I did because it was a calculated guess, because I've worked in my political environment for the past 20 years with 7 ministers for my sins. So I knew how much I could risk. And it worked for me in my context of just sharing an official resource from the internet online, okay, as a comment or whatever. In some countries, in some environments, not even this might be acceptable. You might be aware that we still have one large country that says they never had COVID, okay, and it's bound by land borders. It's not an island in the middle of the Pacific. I will not mention names, but there a doctor can't even tell you have COVID. They will tell you something like, you have, if I'm not mistaken, new pneumonia or something like this, they call it. Okay, they never use the word COVID. So, yeah, there's so much we can do. But in the trainings, I've seen people removed from office, relegated to, a dark corner somewhere. I haven't encountered anyone who has been assassinated yet, but obviously I can't exclude that people have gone through that. please, anything you do, take calculated risks. And if you're junior, seek advice with a trusted senior. Okay? Always make use of the system that you trust as well, because there's a lot of experience in that. I hope that helps.
Buenos días, Cristian García, jefe del Departamento de Epidemiología del Ministerio de Salud de Chile. Muy interesante lo que nos plantea respecto al nuevo campo digital. Esta es una conferencia de epidemiología de campo. Es un nuevo campo al cual explorar, es un nuevo campo al cual hacer esta epidemiología. Así como en un inicio se pudiesen ver relaciones físicas entre las personas. De hecho, la mayoría de las experiencias son experiencias en terreno, de contacto físico de las personas, incluso del epidemiólogo de campo con la comunidad. Y esto es un nuevo campo. La vía se ha digitalizado completa, desde las compras hasta uno puede no salir de su casa en toda la vida, casi, hasta recibir medicamentos, atención online. ¿Cómo ve y cuál sería la recomendación para la formación de estos, entre comillas, ¿cierto?, epidemiólogos de campo digitales para el futuro? ¿Y cómo poder enfrentar estas nuevas señales y desafíos que se vienen por este nuevo escenario?
So I think there's a couple of comments I'd like to make to that. It's a bit difficult to tell you how to train our trainees because the technology changes all the time. But I must also admit that I typically learn a lot about technology from my trainees and from my daughter. Okay? So trust me, they know technology. They might just need some guiding, but they know technology very well. So that's one element that I would strongly recommend thinking of. The second element is do not discount that feedback that you're getting from the field. One of our best sources, one of our best media to deliver risk communication community engagement in my country was to organize online meetings for GPs, for family doctors. Because in our society, the family doctor is the new priest, if I can use an analogy with Christian communities, right? So the population trusts their family doctor. They know them from the time they were in nappies, right? So let's make use of whatever is made available to us. And I think, to be honest, our youngsters are a resource that we can use as well as part of that training.
Just one last question. Thanks.
Gracias, felicitarle por su exposición. Nosotros somos parte de la delegación de República Dominicana. Este es un nuevo mundo en donde la inteligencia artificial viaja a 200 millas por minuto, perdón. Y este tipo de exposición para nosotros tiene mucho valor porque es algo que se nos presenta a diario en nuestras comunidades cada vez que llegamos a una emergencia. Entonces, quisiera preguntarle qué piensa, tengo dos preguntas, disculpe abusar un poco, qué piensa de utilizar esa comunidad empírica, informativa, que nos combate a diario con toda esta información a veces falsa, a nuestro favor de alguna manera, o sea, no solamente verlo a ellos como combatientes, sino, y disculpen el término, sino también utilizarlo a nuestro favor. Y la otra pregunta es que en nuestras agencias, ministerios, producimos un montón de información diario, pero de esa información que cada día muere, porque la información que producimos hoy ya puede ser que mañana no sea útil, solamente compartimos un 20% al público. ¿Qué piensa de que podamos de alguna manera explotar un poco más esa data que se produce a diario?
Great question. I understand your country is a small country like mine, maybe a bit larger, I don't know, I can't remember the population. But it can still be done. So basically, I would say, first of all, you always have to keep your ears open. I'll tell you how we did it during the pandemic, even before WHO made the social listening tool available to us. We basically targeted the biggest Facebook groups, because that's where most of our population was. And we used them to get the temperature, to get the feel of what people are talking about online. Sometimes we actually engage directly with debunking and pre-bunking in some cases. Okay, pre-bunking is where you post information before the misinformation starts flowing. Debunking is when you do that after the misinformation starts. Okay? And we also designed our communication around it. But there's one important element which I think is relevant to your question. The timeline from generation of information to release of information has to be short, has to be very short, potentially even down to 24 hours. So in some countries, this has failed because ministries of health have been trying to use their usual clearance pathways. That does not work with social media. It will be old news by the time you release it. And I think this is critical in actually effectively communicating what you're generating. Okay, I understand time is up. So thank you very much and for listening.
Thank you so much. I think the next session is our oral presentation, so if you can all head to those soon, and we'll get that underway.